What are you doing?
Hours after a Victoria resident voiced concerns about Royal Jubilee patients being left at a bus stop, she witnessed hospital security bring another person in apparent distress here.
It's horrific that this is normalized.
In Vancouver, Remi Caudron says he's seen VGH security escort dozens of patients to a bench across the street.
It's being used as a people dump.
This issue of what happens to people when they leave the hospital is of central concern to everybody who works in a hospital in BC.
BC's health minister says our hospitals see 200,000 emergency room visits per month, and he doesn't believe patients are being dumped outside. But those aggressive or abusive to staff may be escorted out.
There are circumstances where a patient, for whatever reason, is being disruptive and needs to leave.
Since hospitals are not hotels or shelters, what options are there for staff when a person without a home is ready for discharge?
Well, they often work with that person. They have lists of housing that might be available. There's a series of supports that can be given. Once you're determined you don't need to be there,
including bus passes and taxi vouchers. Staff often check on shelter bed availability, says Adrian Dix, and social workers may also be involved in assisting people.
You can't just dump people at a transit station or a bus stop. My goodness, especially if folks are struggling with mental health issues.
Opposition leader Kevin Falcon says if he becomes premier, he'd legislate the limited use of involuntary treatment in modern facilities with 24/7 psychiatric and medical supports.
When they're incapable of making decisions on their own, we have to make sure we're looking after them.
Dix says people have rights and involuntary care is not necessarily a solution. Meantime, Juliana says she helped this patient stay warm while another bystander called an ambulance, which returned the woman to Royal Jubilee Hospital. Kristen Robinson, Global News.